Hello guys, so now we shall be discussing regarding the anatomy of your thyroid gland. Okay, so our topic of discussion would be anatomy of your thyroid gland. Now, if you look at this thyroid gland, you know that thyroid gland is bilobar, right? So it is like a butterfly. So this is how your thyroid gland is looking, right? So this is your thyroid gland all the way. So this is the shape of your thyroid gland. Now, before we discuss the thyroid gland over here, one very important thing you should know is that first of all you should know the topography of this particular gland. So thyroid gland ranges all the way from C5 till T1. Okay, from C5 cervical vertebra till T1 cervical vertebra, thoracic vertebra till T1 thoracic vertebra. This is the topography of your thyroid gland. Second important thing is that this particular thyroid gland is having two important lobes. What are these two important lobes? One is called as your right lobe. Another one is called as your left lobe. So how many lobes are there? One is called as the right lobe, another one is called as your left lobe. Now, this right and left lobe together, they are joined by a special structure over here. This is called as your isthmus. Right and left lobe together is joined by what? Together it is joined by your isthmus. And where is exactly thyroid gland present? If you look at this picture, this particular picture over here, you see this is your thyroid gland all the way. This represents your thyroid gland. Now, where is this thyroid gland present? This thyroid gland is wrapped around your cricoid cartilage and also it is wrapped around the superior rings of your trachea. What do I mean by that? What do you mean by that is, for example, let us say you have got a structure called as hyoid bone like this. This is your hyoid bone. Now, beneath your hyoid bone, you have got this particular cartilage which is shield shape. What is this cartilage which is shield shape? So this cartilage which is shield shape is called as your thyroid cartilage. And just beneath your thyroid cartilage, you have got a ring-like structure like this. This particular ring-like structure which I am drawing right now, right? So this particular ring-like structure which I am drawing right now is called as your cricoid cartilage. So all of you should know this thing, that this particular bone over here is called as your hyoid bone. This is called as your hyoid bone. Next important thing, this is called as your thyroid cartilage, and this one over here is called as your cricoid bone. Okay. Now, and just beneath the cricoid, what do you have? Beneath the cricoid, you have got your tracheal rings. So these are your tracheal rings over here. So these are your tracheal rings. Now, where is your thyroid gland present? Okay, so important thing you need to know is that thyroid gland is completely enveloping your cricoid. So this is the exact location of your thyroid gland like this. Okay, this is the exact location of your thyroid gland in this way. So where is this thyroid gland? Thyroid gland is enveloping your cricoid and also the superior part of the tracheal rings. So where are your superior tracheal rings? So these structures over here are your tracheal rings. Tracheal rings. So it is enveloping the superior surface of your tracheal rings. So this particular gland which you can see with a central isthmus over here is called as your thyroid gland. Okay, so to write it down, thyroid gland, what it is doing? Thyroid gland is wrapped around. Thyroid gland is wrapped around the cricoid cartilage and superior rings of trachea. And your superior rings of trachea. So thyroid gland is wrapped around the cricoid cartilage as well as the superior rings of trachea. So this is what is called as your thyroid gland. So obviously no surprise that this part is called as your right lobe of the thyroid gland. This is called as your left lobe of the thyroid gland, and this part in between is called as the isthmus of the thyroid gland. Isthmus of your thyroid gland. Okay, so down over here you see here also the same picture. So this is the exact position in relation with the neck where your thyroid gland is located, right? So this is the exact position of your thyroid gland in the neck. Okay, so this is the position of your thyroid gland. Now one very important clinical point I want to discuss here is, and by the way, if you look from the back posteriorly, if you look, So this is how the thyroid gland is present. Now tell me, thyroid gland is circular? No. Thyroid gland is semicircular, right? Anteriorly there is complete thyroid gland, right? When you see posteriorly, the posterior part of the thyroid gland is incomplete over here. Okay, so it is ending over here. So, and by the way, you see this particular triangle over here, this particular triangle is called as Killian's triangle, which I have explained in the previous lectures. Killian's triangle. So this Killian's triangle is the weakest part, where this part of the Killian's triangle, what will happen is that this will protrude outside like this. And this protrusion of this Killian's triangle outside is what is called as your what? What is this particular protrusion over here called as? This is called as Jenker's diverticulum. Okay, this is called as your Jenker's diverticulum. Now, one very important clinical point I want to discuss over here is that regarding a cyst called as thyroglossal cyst. Thyroglossal cyst. Now, what is this thyroglossal cyst? What is this thyroglossal cyst is that? First of all, let me draw a few pictures over here. Let us say this is the tongue. Okay, just beneath the tongue over here, I mean, we are actually drawing from the lateral aspect. So, from the lateral aspect, this is the tongue, and this particular bone which I am drawing right now is called as your hyoid bone, like this. Okay, now just beneath your hyoid bone, this particular cartilage which I am drawing right now is called as your thyroid cartilage. And beneath your thyroid cartilage, you have got another cartilage called as cricoid. Attached to the cricoid, you have got your tracheal rings. Okay, so what are the important things? See, this particular bone over here is called as your hyoid, and this particular structure over here is called as your thyroid cartilage. And this particular one over here is called as your cricoid, and after that, these structures which you can see over here are called as your tracheal rings. Now, where is your thyroid gland? First of all, before we discuss thyroid gland, very important thing you need to know is that, see, this is a picture of the anterior surface, right? I will draw and rub it out. Just look here. You see, this is your neck. This is a skull like this, right? So I'm just rubbing it out now. So why I have drawn this picture is that I just wanted to tell you that this is your anterior side and this is your posterior side. This is on the front, that is on the back. Now on the posterior side, on the posterior aspect of your tongue, you have got a small opening here. Okay, so this small opening that is located on the posterior aspect of the tongue is called as foramen cecum. What is this particular opening called as? This is called as foramen cecum. Okay, so this posterior opening on the posterior surface of your tongue is what is called as your foramen cecum. Now what I am telling you is that from the foramen cecum, the thyroid gland development will start. Where does the thyroid gland development is starting? It is starting from the foramen cecum. Okay, so here small thyroid gland is developed. Okay, and here a little bigger one, and here a little bigger one again. So in this way, thyroid gland develops all the way from the foramen cecum, and this gland comes all the way down till the place where it has to be present. Okay, so exactly here if you look, this is the place where your thyroid gland is present, like this. If you are looking it from the side, that is why you cannot see the isthmus, because you are looking from the side. Now what will happen is that attached, now as this thyroid gland development slowly is taking place all the way from foramen cecum till here, now the question is, by which week will the thyroid gland come to the throat? In front of the larynx, right? In front of the larynx, by which week the thyroid gland will come there till the front of the larynx? It will come by 7th week. Okay, it will come by 7th week. And second important thing is that connecting all the way from the foramen cecum here, connecting all the way from the foramen cecum to this thyroid gland, like this, you see, connecting all the way from the foramen cecum to the thyroid gland, you see a duct here. You see a duct. So this is the duct that is connecting all the way from the foramen cecum all the way till the thyroid gland. So this duct is called as thyroglossal duct. Why glossal? Because it is present on the back of the tongue. So glossal. And here it is thyro. So this duct is called as thyroglossal duct. So a duct is formed over here. This is called as thyroglossal duct. Okay, it is with the help of the thyroglossal duct, the thyroid gland from the foramen cecum is descending down into the anterior part of your larynx. Okay, so at which week will the thyroid gland descend down here? At 7th week. Fine. After 7th week, what will happen in the next 10 weeks? Slowly this duct, you see this? Slowly this duct will disappear. So when is this duct disappearing? This duct is disappearing slowly by 10th week. So regression, disappearance is called a regression of this duct, thyroglossal duct. Regression of this thyroglossal duct happens by 10th week. So this is a normal embryology which you see in you and me. But in some patients what will happen is that this thyroglossal duct will not regress. You see, this is a thyroglossal duct like this, and this particular thyroglossal duct will not regress. Okay, so when it will not regress, what will happen? So whatever secretions are there here, obviously within the tongue, right, beneath the tongue here, right and left, everywhere you have got glands, submandibular glands, sublingual glands and all, salivary glands are present, parotid gland. So all secrete the secretions onto the tongue. Now when you swallow, there are chances that all these secretions, they start entering into this duct. And what will happen? What will happen is that at certain places, this duct will enlarge like this. At certain places, all these secretions are accumulated in one part of the duct, and this is what happens. And this structure which is formed right now because of a pool of secretions, right, this is called as thyroglossal cyst. Thyroglossal cyst. So two things we discussed. One is called as your thyroglossal duct, which has transformed into your, in the parts of thyroglossal duct, there is thyroglossal cyst. Okay. If you look at the real patient, this is how it looks. You see, this is a cyst that is present in this anterior wall of the neck, and this is his thyroid gland over here. Clear? Yes or no? So this particular cyst which you can see over here is called as thyroglossal cyst. And sometimes you know what will happen? Sometimes what will happen is that, let us say that this particular structure over here is your thyroglossal cyst. Okay, this particular structure over here is your thyroglossal cyst. And let us say that this is the neck region. Okay, now in some patients what can happen is that, this cyst, okay, you see this particular cyst will open outside. So when it will open outside, what will happen? All these secretions, whatever are there, these secretions are leaked outside. This is called as fistula, thyroglossal fistula. Okay, so this is some of the very important thing which you need to know regarding your thyroglossal cyst. Okay, very, very important. Now what we shall discuss is that what are the anatomical relations. It means anterior to the thyroid gland, what muscles are present, back side of it, what muscles are present, laterally what muscles are present, we shall look at that. So we shall right now discuss about the relations. Relations of the thyroid gland. Okay, so our topic would be the relations of your thyroid gland. Right. So if you look at what are the relations of the thyroid gland over here. Now let us try to identify this picture. See here, first important thing I want to tell you is that this particular structure which you can see, this is called as your cervical vertebra. I'm just writing it as C. Where is your thyroid gland? This pink color gland over here which you can see here, right? This is called thyroid gland, and now I'm drawing this particular structure called as isthmus. And again, this is another lobe of your thyroid gland. This is your thyroid gland. Clear? So let me highlight it. You see, this entire part is your thyroid gland. Now let us see what are the structures that are located in front of the thyroid gland. In front of the thyroid gland, you see three muscles. What are those three muscles? You see, one is sternohyoid muscle, next one is your omohyoid muscle, and next one is your sternothyroid muscle. What is sternohyoid? Sternohyoid is a muscle that is attached all the way from the sternum to the hyoid bone. Okay, that is your sternohyoid. For example, let me show it to you. Let me show it to you in this particular picture. Okay, let me draw another picture and show it to you. So just look at this picture right now. So what is sternohyoid, sternothyroid and all, right? You know that this is your hyoid bone like this. This is your hyoid. After this is hyoid, this bone over here is called as your thyroid cartilage. Next, down over here you have got your cricoid. This is called as your cricoid, and beneath the cricoid over here you have got, let us say, sternum, and this is your clavicle like this. This is your clavicle, right? Now, first important thing is, first of all, let me write down these things. So this particular part is your hyoid bone, and this is your thyroid cartilage, and this is your cricoid cartilage. Now the first important thing is sternohyoid muscle. Sternohyoid in the sense, all the way it starts from the sternum, it goes up. See here, all the way it starts from the sternum like this, and it goes up all the way till the hyoid bone like this. You see this muscle which is going all the way from the sternum to the hyoid bone. So this particular muscle which is going all the way from the sternum to the hyoid bone is called as sternohyoid muscle. Okay. Next, where is it located? Where is your thyroid gland? Your thyroid gland is somewhere here, right? Where was your thyroid gland? Your thyroid gland was somewhere here. So can I tell it is this muscle is located in front of the thyroid gland, right? Next is next muscle which we have got is sternothyroid. Sternothyroid in the sense, all the way it starts from the sternum to your thyroid. All the way it starts from the sternum to your thyroid, right? So if you want to learn the exact things, on the thyroid cartilage we have got some lines called as oblique lines. Okay, so this muscle goes and all the way attaches to your oblique line of your thyroid cartilage. So this particular muscle over here is called as your sternothyroid muscle. Okay, and next there is another one called as omohyoid, which I cannot show it to you here, but just remember it like that. So what are the three muscles in front of your thyroid gland? One is your sternohyoid, omohyoid, sternothyroid. Let us write it down. So first let us discuss about the anterior relations. Now when it comes to the anterior relations over here, anterior relations are having the first muscle. What is that? Sternum to hyoid, sternohyoid, sternohyoid muscle. Second important thing, sternum to thyroid, sternothyroid muscle. Sternothyroid muscle. Third important thing is omohyoid. Within the omohyoid, we have got two important things. One is called superior belly of omohyoid. Another one is called inferior belly of omohyoid. Okay, actually this is how the muscle is present. Look here. Let us say this tendon which you see on the both the sides, this is called as intermediate tendon. Okay, so one part of the muscle is like this. I am drawing the muscle with the green. Okay, so one part of the muscle is in this way, and another part of the muscle is like this. So this part of the muscle which is seen above the intermediate tendon is called as superior belly of omohyoid. Next part which you can see which is present below the intermediate tendon is called as inferior belly of omohyoid. Okay, one you have is the superior belly of omohyoid, next you have is the inferior belly of omohyoid. Okay, so this one over here is called as superior belly of omohyoid. This is called as your inferior belly of omohyoid. Now we are discussing right now about the superior belly of omohyoid muscle. Superior belly of omohyoid muscle. Okay. So what are these muscles over here? These muscles over here are called as your infrahyoid muscles. Why infrahyoid muscles? Now tell me, are these three muscles crossing above the hyoid bone? See, this is the first muscle below the hyoid bone, so infrahyoid. This is the second muscle below the hyoid bone, so infrahyoid. This is the third muscle below the hyoid bone, so infrahyoid. So all these three muscles over here are called as your infrahyoid muscles. Infrahyoid muscles. So all the three important infrahyoid muscles are forming the anterior relation, are located anterior to the thyroid gland. They are forming the anterior relation of your thyroid gland. Now laterally, what do you mean by laterally? Laterally in the sense, these things are called as laterally. See, this is called lateral. This is called lateral. Shall I use red? You see, this one and this one is called as lateral. Laterally, what are the structures do we have? So what are the lateral relations? What are the lateral relations? Now coming to the lateral relations, look at the lateral relations right now. See, let me highlight it. Lateral to this, you see that there is a sheath like this. Okay, what I will do is I will remove this sheath outside. See here, there is a sheath in this way, right? Now within this sheath, there is a structure like this. Within this sheath, there is a structure that is with the red like this, and there is another structure which will be with the blue. Actually, this picture is completely black and white, so you won't understand it. So another structure which I am drawing it with the green. Three structures you see. Once again, I am zooming this picture. Just look at here. See, there is a structure with the red. Okay. Side to that, there is a structure with the blue. And now I am drawing, there is a structure with the green like this. Where are they located? All these structures are enclosed in a sheath like this. Here also, the same thing. You see a sheath, right? Within this sheath, you see a red color structure. You see a blue color structure. You see a green color structure. Okay. So what are these three structures over here? So one, this particular structure over here, is called as common carotid artery. The blue one is called as internal jugular vein. And this green one over here is called as your vagus nerve. This is called as your vagus nerve. So all of the three are enclosed in a sheath, and this sheath is called as carotid sheath. Carotid sheath. So laterally, what are the structures that are located? Laterally, first we have got a sheath like this, right? So this particular sheath which you can see here, right? This particular sheath which you can see here is called as your carotid sheath. Now within this carotid sheath, there is a artery like this. This is called as common carotid artery. Next, we have got a vein in this way. This is called as internal jugular vein. And next, we have got a lymph node, a nerve here. This is called as your vagus nerve. Okay. So let me write down these things. So the first important thing over here is your common carotid artery. Second important thing over here will be what? This will be your internal jugular vein. Third important thing over here, what is this? This is called as your vagus nerve. Vagus nerve. So common carotid artery, vagus nerve and internal jugular vein. These three form your lateral relations. Lateral relations. Now after the anterior and after the lateral, the next important part is your medial relations. What are the structures that form the medial relations? What are the structures that form the medial relations? Medial relations in the sense, you see this is a gland. Okay, how is that picture there? This is how the picture is there, right? This is how the picture is there, right? So in the center, whatever structures you see, this forms the medial relations. So in the center, what are the structures you have got? You have got one structure called as esophagus. You see esophagus is over here. You see another structure called as trachea. Trachea is there, esophagus is there, larynx is there, pharynx is there, right? So all these structures are located in the center here. For example, if this is your thyroid gland, this is your thyroid gland like this. Okay, this is your thyroid gland. So if this is your thyroid gland, this structure over here is called as your anterior. This one is called as lateral. This is called as lateral, and this one over here is called as your medial structure. Medial structure. So the structures that are located medially are the first important thing. What is the first important thing? That is your larynx. After the larynx, the second important thing would be pharynx. After the pharynx, the third important thing would be trachea. And after the trachea, the fourth important thing would be your esophagus. Esophagus. So these are the nerves which, these are the structures which are located medially. Okay. Now, when I tell about thyroid gland, when I discuss about the thyroid gland, what is the nervous innervation of the thyroid gland? What is the nerve that innervates the thyroid gland? Okay, so one nerve is called as external laryngeal nerve. We have talked about this in detail previous lectures. External laryngeal nerve. This is the first nerve, and second important nerve is a recurrent laryngeal nerve. Both of these nerves are the branches of vagus nerve. Recurrent laryngeal nerve. So these are the two nerves that innervate your thyroid gland. Okay. Now after this, let us discuss about the blood supply. Let us discuss about the blood supply. Now when it comes to the blood supply, I want you to understand one very important thing, that you see an artery over here, this particular artery, right? So what I will do is that I will just remove the arteries which are not necessary. Okay. So first of all, let me remove all of these parts so that very clearly I can discuss what are the different arteries over here. Okay. So let me remove this part over here on both the sides and freshly write down these arteries over here which are in relation with your gland. Okay. Right. The first important thing which you can see over here is, first of all, we have to locate the gland. Where is the gland? See, where is your thyroid gland? This particular gland over here is called as your thyroid gland, and this is called as the isthmus of the thyroid gland. So you understood where is your thyroid gland over here. Now after understanding thyroid gland, you should know one very important thing. This particular artery over here is called as brachiocephalic trunk. Brachiocephalic trunk. This particular artery is called brachiocephalic trunk. Brachiocephalic trunk is dividing into two branches. This one is called as a right subclavian artery. Okay, and after that, what is this branch called as? This particular branch is called as right common carotid artery. Okay, now this common carotid artery will divide into two branches. See, this particular branch over here is called as internal carotid artery, and this particular branch over here is called as external carotid artery. Okay, from the external carotid artery, you see a branch that is coming down and supplying to the thyroid from the top very clearly, right? So this particular branch which is coming all the way from the external carotid artery is called as superior thyroid artery. This is called as superior thyroid artery. Okay, done. Next important thing is that you see, this is your right subclavian artery. Okay, and this one is called as your left subclavian artery over here, right and left subclavian artery. From this subclavian artery, you have got very important branch. You see this branch that is going up here. This branch over here is called as thyrocervical trunk. Even if you are not understanding this, I will draw it later on. Thyrocervical trunk. So a branch of thyrocervical trunk which is supplying to the inferior surface is called as inferior thyroid artery. Now let us look at that picture with the picture which I draw right now. Okay, let us look at that picture right now. So what I was telling you is that there is an artery in this way. This artery is called as your arch of aorta. Okay, arch of aorta has got branches on the right, one branch on the right, and it has got two branches on the left. Okay, so the branch that is located on the right is called as, this one is called as your brachiocephalic trunk. This brachiocephalic trunk gives two branches. One is called as a right subclavian artery, another one is called as your common carotid artery. Okay, even on the left side, directly you have got left common carotid artery and directly you have got left subclavian artery that is coming out. Okay, so let me write down this so to avoid the confusion. This is called as your arch of aorta. This particular artery is called as BCT, that is brachiocephalic trunk. So this artery over here is called as your arch of aorta. Next, this particular thing over here is called as BCT. BCT stands for what? Brachiocephalic trunk. And this brachiocephalic trunk is dividing into two branches. This one is called as your right common carotid artery. This is called as your left common carotid artery. Right common carotid artery and left. And also this one is called as your right subclavian artery. This is called as your left subclavian artery. The only difference is that on the right side, common trunk is brachiocephalic trunk. That same brachiocephalic trunk is absent on the left side. Right. Now this common carotid artery will in turn divided into two branches. So one branch that is going out, okay, one branch here, this is called as your internal carotid artery, and another one is called external carotid artery. So this branch over is called internal carotid artery and this is called external carotid artery. Clear? Right? Now the same thing is happening on the left side as well. So what I will do is that let me stretch this part a little bit. Okay, let me stretch this part a little bit so that it would be easy for us to understand the thing. So this is your arch. I will just stretch the part. Okay. Now left common carotid artery also divided into two branches. See, this is called external carotid artery and this one over here is called as your internal carotid artery. So this one over here is called as external carotid artery and this is called as internal carotid artery. Okay. Now where is your thyroid gland? So exactly here you have your thyroid gland. Isthmus, and this is your thyroid gland over here. Right. Now what I'm telling you is that from the external carotid artery you see a branch that is coming and supplying to the thyroid gland from the top. So this is called superior. It is supplying from the superior side, or the inferior side, it is supplying from the superior side. So you call this particular artery as superior thyroid artery. Okay. Now in the same way, from your right subclavian artery and left subclavian artery also, you see a branch that is coming. Okay. So this branch that is coming like this particular branch that is coming like this is called as your thyrocervical trunk. Okay. What is this branch? This branch over here is called as your thyrocervical trunk. Now what I am telling you, from the thyrocervical trunk, one of the branch of thyrocervical trunk supplies to the thyroid gland at the lower aspect like this. Okay. Now this branch which is supplying to the lower aspect, now this one is supplying to the thyroid gland from the below. So should I call this as superior thyroid artery or inferior thyroid artery? I should call this as inferior thyroid artery. So this particular artery over here is called as your inferior thyroid artery. This artery over here is called as your inferior thyroid artery. So how many thyroid arteries we have got over here? One is called as your superior thyroid artery over here, and these arteries are called as your inferior thyroid artery. Okay. So regarding this blood supply, I have to write that there are two arteries over here. One is called as superior thyroid artery, another one is called as inferior thyroid artery. Okay. Now when it comes to the superior thyroid artery and inferior thyroid artery, superior thyroid artery is a branch of what? External carotid artery. Inferior thyroid artery is a branch of what? Thyrocervical trunk. Thyrocervical trunk. Okay. So this is regarding the blood supply. So this is regarding the blood supply of your thyroid gland. Okay. Now after the blood supply, the next important thing we shall be discussing is your venous drainage of your thyroid gland. This is the venous drainage of your thyroid gland. Very easy to remember. Just remember that there are three veins that are taking the blood from the thyroid gland. One is called as the superior thyroid vein, into which the upper part of the thyroid gland will drain. Next is called as a middle thyroid vein, and next is called as the inferior thyroid vein. So what are the three particular veins? We have got one is called as a superior thyroid vein, next we have got is a middle thyroid vein, and next we have got is your inferior thyroid vein. So there are three types of thyroid veins. Now where are these thyroid veins? All of them finally draining into, all these thyroid veins are draining into your brachiocephalic vein. Okay, the superior, middle and inferior thyroid veins are finally draining into your brachiocephalic vein. So let us just revise the things which we have discussed here, guys. We discussed that there is something called as your thyroid gland, right? Thyroid gland is having how many lobes? It is having two lobes. This is called as your right lobe, this is called as your left lobe, and this center part is called as your isthmus. So it is ranging all the way from C5 to T1. Second important thing is this one. Thyroid gland is wrapped around the cricoid cartilage and the superior rings of trachea. Next important thing, on the back side it is incomplete. On the back side it is incomplete, and there is a triangle called as Killian's triangle. where a diverticulum is formed, that is called as Jenker's diverticulum. Next we have got something called as thyroglossal cyst. Okay, so you know that thyroid gland comes to this position at the 7th week. Next, this thyroglossal duct will regress by 10th week. If it is not regress, secretions will form and leading to thyroglossal cyst. So this is the thyroglossal cyst. What are the relations? Anterior relations are sternohyoid muscle, sternothyroid muscle, superior belly of omohyoid muscle. All these are the infrahyoid muscles. Coming to the lateral relations, common carotid artery, vagus nerve and internal jugular vein. Coming to the medial relations, larynx, pharynx, trachea, esophagus. So these are some of the important things which you need to know regarding your thyroid gland. Thank you so much for watching my video. Goodbye.